it also does medial rotation. Okay? But subscapularis is the S of sits, the second S. So supraspinatus, infraspinatus, teres minor, and subscapularis. And I think I have those marked on your lecture notes as being components of the rotator cuff. Okay, so finally our last muscle on page 29, at the very bottom, is latissimus dorsi. Have you ever heard of, I'm going to work on my lats? What's an exercise at the gym to strengthen your lats? Reach up.
You want me to say it?
Grab the bar.
Do a pull-up.
Yeah, pull-ups. Either pulling the body up or pulling the bar down.
I thought you guys, you're all looking at me.
What am I doing? Extension. That's the major movement of latissimus dorsi, is extending the arm. This is flexion. This is extension. Okay? Now I finally, after years, figured out why my students at Sac State were always messing up flexion and extension. And it was from it. This happened this semester. They talk about, well, extend your arm in friendship. That's not extension. That's flexion.
Why?
So apparently they were thinking of that extend your arm, and you're extending your elbow, but the arm itself is flexing. Okay? So you reach up and do pull-ups, or you grab that bar and pull it down. You're doing this movement with the arm, and this is in extension. So flexion, extension, or hyperextension. Sometimes some people use hyperextension to mean you have to start breaking ligament fibers. It has to hurt. For other individuals, it means going past the straight line. I don't care whether you use extension or hyperextension. All right. So this muscle is a very broad muscle that comes from the vertebra, the iliac crest. It's rather thin and sweeps all the way up the lateral aspect of the body, makes a kind of twist, and attaches to the humerus near the pectoralis major. It goes on the inside of the arm, so it's also going to do medial rotation. So it comes up, let me show it to you on the torsos. So this muscle right here, see how broad it is? Comes up here, twists, and inserts onto the shaft of the femur. So its function, major function, is to extend the arm, but it's also going to do medial rotation because of the angle it comes in. Now if you look at bodybuilders, here's the armpit. The pectoralis major forms the anterior wall of the armpit. Latissimus dorsi forms the posterior wall. Okay? So that gap between those two muscles creates the axilla or armpit. Latissimus dorsi, pectoralis major. Okay, we'll stop there. We have some lab time. You guys want me to bring the cadaver out here, or you want to go in there?
Let's bring it out here.
You'll have more room to work on it. I'm going to bring it out here on Thursday. If the smell bothers you, you can probably smell it on me a little bit. I would suggest on Thursday that you wear cotton, something that's easy to clean. Wool, it tends to take up the smell and you have to dry clean it to get rid of it. Also, peppermint candy or the medicated Vicks you can put under your nose so you don't smell it. Okay, that works better than a mask. And if you bring gloves on Thursday or any of the next couple of days, you'll be free to, if you have them now, you can handle the cadaver. All right, no dissections, but you can feel the muscles and move the muscles around. So I'll bring, we can see everything we need to see on one of them, on our female. You will actually, we've opened up, taken off part of her vertebra, the spinous processes, and you'll be able to see the cauda equina, conus medullaris, and filum terminale of her spinal cord. Okay? She's had mold when we first got her, so we had to amputate her lower limb, so she's pretty easy to flip. And we can do muscles of the face and muscles of the back.
What did she have?
Mold? It wasn't a disease. She died of colon cancer. But we just kept getting mold, and adding alcohol and all the kind of stuff we used to try to, I'd never seen it on a cadaver before, but it became just, we finally just, after we'd already spent some time dissecting them, just amputated the thigh, cut the thigh, and sent them back to the coroner's office. And we haven't had any problems since then. So I'll bring her in and move the table across at the side, and then call you up in groups of 6 or 7 or so, and go over them, and then you can come back and say them if you wish. Okay?
Take the camera.